The Comfort Theory, created by Catherine Kolkaba. This is Catherine Kolkaba. She was born in Cleveland, Ohio in 1944. Catherine Kolkaba started her journey of being a nurse with her diploma of nursing in 1965. She practiced in a variety of settings like medical, surgical, long-term care, and home care. She then went back to graduate with a Master of Science in Nursing in 1987. During her master's program, she took a nursing theory course that had an assignment that changed her perception of nursing. Over the next few years, she started to formally diagram, operationalize, and contextualize the comfort theory as a middle-range theory. It was not until after she graduated with her PhD in 1997 that she tested the comfort theory. In the early 2000s, she refined her theory to include hospital-based outcomes. In 2003, she published her book on the comfort theory. After this, she continued to test the theory. In her book, The Comfort Theory and Practice, A Vision of Holistic Healthcare and Research, Kolkaba describes the origin of the comfort theory as part of an assignment. The assignment was to diagram her nursing practice using directional arrows to indicate relation. The first practical framework she created was for gerontological nursing. It works under the assumption that if there's contentment in the psychological and physical state of a person, then they will feel more comfortable leading them to better health outcomes. She was later able to make the model broader so that it could be used in other areas of nursing as well. During Kolkaba's extensive research, one of the things that she learned was that the original definition of comfort meant to strengthen greatly. Some of the other things that she learned were that the need for comfort is basic. People experience comfort holistically. Self-comforting measures can be healthy or unhealthy, and enhancing comfort, when achieved in healthy ways, can lead to productivity. Many of these concepts are reflected in her theory. Kolkaba uses 3 nursing theories to describe 3 different types of comfort, which are relief, when a nurse needs to help the patient when they express a need; ease, 13 basic functions of humans that need to be maintained for homeostasis; transcendence, patients can rise above the difficulties with the help of a nurse. The 4 main contexts in which comfort is experienced by the patient are physical, psychospiritual, sociocultural, and environmental. These main contexts all come from further review of literature that she conducted on holism in nursing. Kolkaba's technical definition of the outcome of comfort is the immediate experience of being strengthened when needs for relief, ease, and transcendence are addressed in 4 contexts of experience. The taxonomic structure provides a map of the content of comfort so that nurses can use it to pattern their care for each patient and family member. One way to think of the grid is that comfort is an umbrella outcome that entails relief from discomforts such as anxiety, pain, environmental stressors, and/or social isolation. Because the taxonomic structure represents a holistic definition of comfort, the cells on the grid are interrelated as a whole. Comfort interventions directed at one part of the grid have effects on all parts of the grid.
Hi Alyssa, I'm Reed. I'm going to be your student nurse today.
Hi.
How are you feeling?
Oh, I'm actually in a lot of pain.
Okay, I actually have some pain medication here for you
Perfect,
that you can
thank you.
take that should help.
Thank you.
No problem.
Nurse giving the patient pain medication is a technical intervention of the theory. This satisfies physical comfort.
Do you mind if I sit down?
Yeah, sure, go ahead.
Okay. So how are you feeling about your upcoming surgery?
I'm really kind of nervous about it. I've never had surgery before, and I don't know if it's gonna hurt or what's gonna happen if I'm on the operating table or anything like that.
Okay. Well, it's pretty common to be nervous before surgery. You'll be asleep throughout the procedure, so you shouldn't feel anything.
Okay,
Yeah, after you will probably have a little bit of pain just at your incision site, but the pain from your appendix will be gone once we've removed it, so you'll probably feel a lot better once it's out. And the recovery time for this surgery is usually only a few days, so we'll send you home with some guidelines of what you can and can't do. But you should be feeling back to normal pretty soon, and you'll get to go home tomorrow.
The nurse, taking time to ask the patient how she is feeling about the surgery and reassuring her about her anxieties, was a coaching intervention to satisfy the psycho-spiritual aspect of comfort.
So is there anything I can do for you that might help decrease some of your anxiety about your surgery?
It's kind of stupid, but is there any way that my mom would be able to stay overnight with me here?
Yeah, of course. Does she know that you've come into the hospital?
I didn't have a chance to call her. I was just in pain and rushed to the hospital, and I haven't called her yet.
Okay, well, if you'd like, I can give her a call, and I can have a cot brought into your room so that she can stay the night. And I can see if she can be here for when you come back to the floor so that you're not by yourself.
That would be awesome.
Okay, no
The
problem.
nurse arranging for the patient's mother to stay the night is an example of comfort food for the soul. This is a special, holistic, and more time-consuming nursing intervention that works to satisfy the patient's socio-cultural
Is there
comfort.
anything I can do right now that might help you be more comfortable while you're waiting?
Is there any chance I could get another pillow?
Yeah, of course. Just one sec. Here you go.
Oh, thank you.
This
No
final
problem.
nursing intervention, providing an extra pillow, achieves environmental comfort by making the patient more comfortable with
So I'm
her
just going to go call
surroundings.
your mom, and if there's anything you need, you have a bell right here, and you can just ring that.
Perfect. Thank you.
We used Jacqueline Fawcett's evaluation criteria to evaluate the comfort theory. Significance. Overall, we found that the comfort theory is significant. One of the core elements of this criteria seeks to expose the philosophical claim for which the theory is based on. Kolkoba's theory is based on the claim that comfort, in all its aspects, plays an important role in a patient's healing process. Internal consistency. We felt that the comfort theory met this evaluation criteria because the theory never deviates from the belief that comfort is essential to a patient's well-being. Parsimony. This evaluation criteria focuses on the clarity and conciseness of a theory. Comfort is a concept that is highly subjective, for which case we felt that Kolkoba's theory struggles in the element of parsimony. Testability. Due to the subjective nature of the comfort theory, most of the testing has been done in a qualitative manner. The testability criteria suggests the importance of data analysis, which is incredibly limited with this type of research. Therefore, we feel this theory is weaker in this area. Empirical adequacy. The comfort theory suggests that when a patient is at increased comfort level, the rate of healing increases accordingly. This is backed up by the concept of holistic care, therefore strengthening the theory. Pragmatic adequacy. This evaluation criteria is interested in the overall applicability of the theory. We feel that the comfort theory has no major cost to employ, no extensive teaching required, and is applicable in all different clinical settings. Therefore, we feel that this criteria has been met. Overall, the comfort theory is easy to apply with our patients, and the benefits are undisputable. We support the values this theory enforces as they care for a patient in a holistic fashion. We recognize that this can be more demanding of our time and difficult to maintain as a priority in practice. However, we have seen the importance comfort truly has on patient care.